And what are I think about in a weird way. I don't know if this is going to make it on the roll here, but when I think about my grandparents, and
Mhm.
at a certain point, I remember them. They were probably in their 40s, but they seemed like they were in their 70s.
100 years old.
Yeah, but it was one of those things where in their generation, they were born in the 20s. They just accepted it as, well, this is just getting old.
Mhm.
This is getting older. This is how we age, and they didn't question anything about how to make it better necessarily.
I think
And
that's a lot for men and women in healthcare. And I mean, I have this conversation with people all the time, talking about, well, I'm just getting older. That's what happens when you get older. And I think that there is, again, I think for me, a lot of things are balance. We can't expect to be 20 years old forever. I'm not going to have a 60, 70, 80-year-old guy and tell him that he's going to have erections like he did when he was 18.
yeah,
I'm not going to have a woman and tell her that her bladder control, or a man for that matter, her bladder control, her sexual function, her um, 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 overall sexual health are gonna be the same as they were when they were 18 or 20. But that doesn't mean we just have to accept that because things change with age, we can't improve them. A huge thing, where that comes up is vaginal estrogen,
mm,
and the benefits of vaginal estrogen, to help with, um, bladder discomfort, vaginal discomfort, urinary frequency, urgency, the prevention of urinary tract infections, the prevention of hospitalization from urinary tract infections, the improvement in sexual health and vaginal dryness are huge. And women will say, "Well, but that's just part of getting older, and I'm not sexually active anymore anyway." Well, that's one aspect of it, but that's not the only aspect. And when we can have all these benefits, people also didn't live as long many years ago. I mean, your grandparents, my grandparents, maybe my grandmother lived to be, 100 to 103 years old. But but you know, a lot of changes in our bodies as we evolve, people didn't live as long. Well, we are. Why should we not have quality of life
mm,
as long as we can? Now, that doesn't mean we have to. And that's again where I individualize. Some things are not a priority. And that's also something that's important to recognize is that I come to patients where they are. And so while there was this mentality, like you said, which I totally agree with, especially not even for our grandparents, but for our parents, especially after this women's health initiative, when women were at the time of really, you did not get hormones because they were going to kill you, was the mentality. It was,
mhm,
well, I suffered through it and I did fine. Well, that's great. But just because your mother suffered through it doesn't mean you have to. And it's a different mentality and our knowledge is different. And so we're constantly growing as people. And um, but I also have people where I constantly have the conversation with people. I am not here to talk anybody into doing anything. I am here to provide information and resources and evidence-based knowledge for them to make a decision about what's right for them. And for some people, that means using hormones. For some people, that means using just vaginal estrogen. For some people, it means using systemic estrogen, progesterone, and testosterone. For some people, for men, it means using testosterone or using other medications to boost their testosterone. For some, it means for men, it's the options of improving their erections through various means, or it means accepting that their erections aren't good and exploring other ways to have sexual pleasure without an erection, because that's also something that a lot of people didn't talk about when we talk about our grandparents or our parents, to
yeah,
even know that there's other options. Sexual activity can look different to everyone. And just because you have some issues, if it's not something you want to work on, doesn't mean that that part of your life is gone if you don't want it to be. And so
right.
I think that that's a difference in our generations of realizing that we have options. Things are different. And it doesn't mean you have to do them, but it means that you have the options to you.
Yeah, yeah, that's true. There are definitely options out there now, and probably, I mean, it's for men and women. I'm assuming,
Yes.
we have these certain ideas of what the sexual relationship looks like,
Mhm.
and like you said, it's based on intercourse, and it's
Mhm.
based on the an erection keeping its full steam, so to speak.
Mhm.
Um, but how does obviously when that kind of falls apart, I'm sure that impacts relationships. And I'm
Absolutely.
sure that both for men and for women in menopause, men who are going through sexual health challenges, not only so talk about how it impacts their their relationship romantically, but also their relationships outside of that at work and with their
Absolutely.
yeah.
And that's where the psychosocial part comes in, and that's where, part of what I do is what I do myself, as well as who I refer to, what other resources we have, and working with, therapists, sex therapists, psychotherapists, reading, books that are out there that are helpful, podcasts, because it affects everything, and one thing I discuss with patients oftentimes is I don't care how good a relationship is. It could be a couple that's been together for 20 years, 30 years, whatever, and they talk everything. Their communication is fabulous. When you have new challenges, it can still affect it. And so we talk about that. We talk about what are um, other ways that they can tackle these challenges and how it's affected the other aspects of their life. And there are some people who are very open to talk about this stuff, whether it be with their friends or at work or whatever. I was in a social situation where I was shocked by, these guys that were talking about all this stuff with me, knowing this is what I did and had no discomfort talking about it. And, these were, guys that were, it was just among a group of friends, all married guys. There was nothing, inappropriate about it, but they were very comfortable. Whereas other guys, I mean, they would never discuss these things with anyone, let alone, at work or with their friends. They would never want to admit it. And same with women, women who have, again, we talked earlier about the shame associated with it. Women don't even know what their own bodies look like, let alone how they function half the time. Telling some women, especially older, take a mirror, look at your body, learn what your anatomy is. A lot of women don't even know their anatomy. So when we
Mm,
talk about uh, pleasure or dysfunction, um, they don't even know their own body to have that conversation.
wow.
And so it affects it's a reframing of how they think about themselves as individuals, as part of a relationship, as a sexual human, as a sexual being, so they oftentimes have to reframe that and think about it and relearn. Um, I don't know that this is a the right question to answer this, but it's just making me think of something that comes up a lot is, um, I there's a lot of conversation, um, um, among people in this field. I mean, maybe not the general public, but among people I talk to about the concept of, sex education and how, one of the things that I think really affects older adults, I mean, even including myself probably in that age group, is that, in our country specifically, we talk about sex education. We don't have sex education in our country. We have education about how to not get pregnant and education about how to not get sexually transmitted infections.
Mm,
People are not taught that, whether it be for religious reasons, um, social reasons, whatever, they're not taught about sex being pleasurable and about that being the main purpose. I mean, when you think about how many times people actually get pregnant and have kids, most of your sex life is not about having children. And people aren't taught about that. So people don't know to ask questions if it's not pleasurable or if it's painful
yeah.
or if they don't understand it. There's no education about that. And that's something that I think is eye-opening to a lot of people, learning about their own bodies first, and then also having those discussions with partners, or also if they don't have a partner, that it's okay to be sexual by themselves, and that it's not all about having a baby.
Yeah.
And and learning about how that affects their relationship with themselves, with their partners, and that there's different ways that that can look.
Mhm.